So the first speaker is Helen, our beloved Helen, who will come and tell us about what the AMMF has done recently. Helen. Thank you.
Well, good morning, everyone, and thank you, Lorenza and John, for your kind introduction, and many thanks also for being with us as our co-chairs this year and for your help in putting together such an excellent programme focusing on innovation. I'd also like to extend a really warm welcome to everyone with us here in the UK or joining us virtually from across the world. Before I begin, I'd like to take a moment to remember Professor Narong Kuntikeo, who died suddenly late last year. Professor Narong was a great friend to AMMF over many years, and he is an immense loss to all of us in the cholangiocarcinoma world, but especially, of course, to his family, friends, colleagues, and patients in Khon Kaen, Thailand. We'll always remember Professor Narong's incredible determination, his total dedication to his work, but above all, his humanity. Professor Narong's team are carrying on his wonderful work. I'm sorry, it's difficult. And we are honoured to have members of that team with us here today, and also Professor Ross Andrews, who will be presenting the Professor Narong Memorial Lecture this afternoon. So we will always hold him close. Back in 2002, at its inception, AMMF was the world's first charity dedicated solely to cholangiocarcinoma. And today, 21 years later, we remain the UK's only cholangiocarcinoma charity, now working nationally, across Europe, and collaborating globally. Now, I'm going to give a very brief overview of what cholangiocarcinoma is, the charity's aims, the work we do around those aims, and our current and future projects. We began with 3 aims, and those aims remain the cornerstone of all we do today, to raise the awareness of cholangiocarcinoma, to provide information and support, and to encourage and fund research. Now, much of what I'm going to speak about today is cholangiocarcinoma from AMMF's point of view, what we see is happening, and that might not agree with long-held views. We have some excellent presentations coming up in which cholangiocarcinoma will be fully explained, but I'll set the scene very briefly and cover some of the important facts. Cholangiocarcinoma is one of the biliary tract cancers. The others are gallbladder cancer and ampullary cancer. But it's important that we know there are 3 anatomical variations of cholangiocarcinoma, which is also known as bile duct cancer. We have intrahepatic, when it happens in the ducts inside the liver. Hilar or perihilar happens at the confluence of the main ducts as they join together, leaving the liver and become the common bile duct, which goes down to join the intestines. And this is the most commonly occurring type of cholangiocarcinoma. And there's also extrahepatic or distal, which happens anywhere along that common bile duct from the cystic duct down. So a few fast facts. We know it's the 2nd most common primary liver cancer in the world. In 2019, it was the cause of death of 2,754 people in England alone. That's not the whole of the UK. And mortality parallels incidence. And these facts are borne out by AMMF's cholangiocarcinoma data project. And I'm really pleased that we're going to hear more about that later this morning. Very few inoperable patients will survive 1 year from diagnosis. Now, that's a truly shocking statistic, and one that hasn't improved in decades, although hopefully this may change with the advent of new therapies. Now, although most data show this is a cancer affecting older people, at AMMF, we know this isn't a disease that occurs only at older age. Over the years, we're seeing more young people being affected, which is incredibly worrying. And again, our data project results now support this. These are just a few of the young people known to AMMF and now unbelievably all lost to cholangiocarcinoma. And we're so grateful to their families for allowing us to use their images to illustrate this point. The incidence is increasing year on year globally, and we don't know why this is. We know cholangiocarcinoma is a major problem in Southeast Asia. Thailand, particularly the Northeast, is believed to have the world's highest incidence, and you'll hear more about that later today. So AMMF's work is totally cholangiocarcinoma focused, and improving the future for those with cholangiocarcinoma is always at the heart of everything we do. A diagnosis of cholangiocarcinoma leaves many patients and their loved ones feeling the future is very, very uncertain. And when they contact AMMF, they're confused, feeling isolated and helpless, and they are afraid. So what does AMMF do to support them and help them find the information they need? Well, some of the ways: we have a comprehensive website. This has evolved over the years to become a one-stop shop with complete information on every aspect of cholangiocarcinoma, including clinical trials, open and recruiting. It's clear to navigate and continually being updated. Our main website is geared to the UK, but AMMF is committed to supporting not only those in the UK, but also European patients through greater access to the information, resources, and support they need. So now we have a European website, currently available in 8 languages, with more to come. All patients need to have access to reliable information in a level of language they can understand. There's a wealth of information on AMMF's website, including a number of resources available to download or to request in hard copy, with several available in a variety of languages. The downloadable patient information sheets cover the 5 most commonly used chemotherapy regimens and are endorsed by ENSCA under their Cost Action Project. Through the help of those involved with ENSCA, these are now available in over 30 languages. For the first time, a new second-line treatment is now available for cholangiocarcinoma patients in the UK. Although this treatment will be available to only a few, those with the FGFR2 fusion, most importantly, its approval has, or should have, opened the door to molecular profiling for all with cholangiocarcinoma. So as well as an informative booklet on molecular profiling, our resources include a video available in several European languages. And we supply all our resources to a growing UK network of clinical nurse specialists too. We're daily users of social media. These platforms are important tools, not only for sharing information and news, but also for raising awareness, reaching out as they do to thousands across the world on the news feeds. We also have several private discussion groups focused on those in the UK and Europe, but used by people from all over the globe. These groups, moderated by those with first-hand experience of cholangiocarcinoma, provide enormous support to those working their way through the many difficulties and challenges they're faced with. With the advent of new therapies, however, there's a greater need for cholangiocarcinoma information to help support pan-cancer organisations and healthcare professionals, not only in the UK, but across Europe. So AMMF is currently involved in a patient organisation education project, which will provide information in 3 ways: a comprehensive guide, fast facts, and a PowerPoint summary. Now, this is going to be available in a number of European languages, and these resources will ensure that pan-cancer organisations have adequate cholangiocarcinoma knowledge in their local language, which importantly will help them put together a robust case for healthcare authorities, and so to enable improved access to treatments for those with cholangiocarcinoma in different European countries. Since its inception, AMMF has looked to collaborate wherever possible and to advance the awareness of cholangiocarcinoma and improve the future for those with this most challenging of cancers. In 2015, AMMF initiated World Cholangiocarcinoma Day and invited 5 like-minded organisations from around the world to join us on this venture. And the logo represents the colours of those inaugural organisations, and the figures are us as we embrace the globe, all working to improve the future for those with cholangiocarcinoma. As that one-day annual venture began to grow in influence, AMMF wanted to do more with a globally meaningful, broader, ongoing agenda. So, in 2018, we invited leading international specialists and patient advocates to a workshop in London, where the discussions led to the formation of the Global Cholangiocarcinoma Alliance. This initiative, which began with a shared vision to work with a nationally neutral but globally inclusive voice towards significantly increased global awareness and for progress in diagnosis, treatment, and eventual cure, is now expanding globally and growing in influence, with World Cholangiocarcinoma Day under its umbrella. A major point on AMMF's calendar is our annual conference, an event which has now strengthened its position as a staple date on the global calendar for all with an interest in cholangiocarcinoma. Focused on cholangiocarcinoma, always multidisciplinary, always including patients, and increasingly international, AMMF's conference has proved to be a showcase for what is new in treatments, clinical trials, and in research, and an opportunity to see the scope of AMMF's work and for some great networking. But we have to ask why, despite the years of work to raise the awareness of cholangiocarcinoma, a disease which has an increasing incidence and a dismal mortality, is there still a lack of awareness and little interest with those who have the power to move that dial and fully acknowledge cholangiocarcinoma? Well, we believe the answer lies with the lack of robust data. We see what's happening. We know we desperately need to improve the future for those who remain underrepresented and who lack access to the treatments and the care they so desperately need. But what we see is considered just anecdote and opinion, and that has no power to bring about change. So we decided, if the data isn't there, let's get it ourselves. Back in 2018, we started the process to commission our own data from Public Health England, and latterly with Health Data Insight, so we would at last have that cold, hard data to use as ammunition in our work for cholangiocarcinoma patients. Professor Shahid Khan, who you'll hear from shortly, and Professor Mireille Toledano, both of Imperial College London, have given major input to this work. This project has made some significant findings and resulted in 3 papers now out for publication. And I'm delighted that Dr. Sophie Jose from Health Data Insight, who's worked closely on this project, will be presenting it shortly. A brief aside, in 2013, I was told by the chair of a certain group that the incidence of this cholangiocarcinoma was so low, it wasn't worth separating out from liver cancer. Fast forward 10 years to a recent meeting in Cambridge, after Sophie and I had presented on the background to and the findings of the CCA data project, I felt somewhat vindicated when one of our fellow presenters started his talk with a nod to us, urging us to keep going with the words, "This is really important," and names can be supplied. From its earliest days, AMMF has supported specialist teams researching cholangiocarcinoma. Initially, there was virtually no one interested enough to look at this cancer. What a different story today. To date, AMMF has awarded well over £3 million in research grants to teams across the UK and also internationally. The work carried out by these teams has been amazing, and we're always thrilled to see it published. The most recent was this, just a couple of weeks ago, from the Liverpool team. And we're delighted to have a number of our current grant recipients with us, some of whom will be reporting on their work in Friday's programme. So what's next? I hope you joined us yesterday for our specialist multidisciplinary team session. AMMF's opinion is that each person diagnosed with cholangiocarcinoma should be considered by such a specialist MDT at least once, and should be cared for by those with knowledge and experience of cholangiocarcinoma at known centres of expertise to ensure that their diagnosis is correct, operable, inoperable, and that the most up-to-date and appropriate treatments are recommended for them in the most timely manner possible. Currently, despite all the news of innovative treatments, far too many patients are not referred to knowledgeable specialists and are not under the care of those centres where there is the necessary knowledge and experience, often leading to dire consequences, and we hear these stories daily. We need to change this so that every cholangiocarcinoma patient can be confident that their treatment pathway is correct and they are receiving the best advice and care. So we're now embarking on a Centres of Expertise project. It's very early days, and we know it won't be easy. But watch this space. Thank you.